Raised from the dead? Well, almost. People destined for death live today. Thanks to medical research and very kind individuals, life has been restored by a gift. I'm Marilyn Priel, host for The Better Part. Stay tuned while we learn about organ and tissue transplants and donations, miracles in our lifetime.
Welcome to The Better Part, a program by and for seniors and devoted to exploring the many facets of those better years of our lives. The name of our program was inspired by a quotation from Robert Browning. Grow old along with me, the best is yet to be, the last of life for which the first was made. Now, sit back and enjoy a program made especially to provide seniors with useful information, plus some lighter moments to brighten your day.
Thank you for joining our program. Our guests today are Mary Wallace. She's with the California Transplant Donor Network, and Judy Renier, who is a transplant recipient. Thank you for coming, ladies.
Thank you for having us.
Mary, to begin with, would you tell us what is the California Transplant Donor Network?
Nice, well, you got through the name, great. The Transplant Donor Network is a federally designated organ procurement organization. Now, what does that mean? What it means is that we have been charged by the federal government with doing the education, the recovery, the consent process, and all of the things relative to organ donation in Northern and Central California. We're a nonprofit organization, and we serve the families and the people of Northern and Central California.
You say it's federally designated. Now, what agency? Is it the Health Department of the federal government who organized this?
It's the Department of Health and Human Services. And the Department of Health and Human Services about 13, 14 years ago designated a national agency, the United Network for Organ Sharing, to be the list keeper, the keeper of the national waiting list for organ donation and transplantation. And they created a nonprofit foundation to do that because they felt it was very important ethically that the government stay out of anything relative to who gets what when you talk about organ donation and transplantation. And the government, in conjunction with the United Network for Organ Sharing, or UNOS, designated 59 organ procurement organizations throughout the United States to serve local areas so that we can serve the population in the best possible way by being designated locally.
So you're saying then if someone in Ohio need an organ, they could come to California to get it. They don't have to stay in Ohio because it's a federal list. Is that?
That's absolutely correct. Let me clarify it just a little bit, though. Every person who is eligible for transplantation is put on the National Transplant Waiting List by their transplant program. In our area here in Northern and Central California, we have 3 transplant programs. Stanford, which is in Palo Alto. We have University of California, San Francisco, which is in San Francisco, of course, and then we have California Pacific Medical Center, which is in San Francisco. There are also 2 programs in Sacramento. Those programs are designated by the federal government as places where people can receive transplants. Those doctors are the only ones who can put people on the National Transplant Waiting List, and only the people on the National Transplant Waiting List are eligible to receive organs that are donated by the generous individuals in the United States. Mostly, organs that are donated locally are allocated locally because they can only live outside the body for a short time. So while some organs could go to Ohio if someone was in desperate need, most often they go to the people right here in Northern and Central California. And 80% of the time, an organ that is donated locally is transplanted locally as well.
What happens, like someone's waiting to have a donation, to have the transplant, And they're off in some little town somewhere, and the donor's off in another little town. What happens?
That's a really interesting question, Marilyn, and it's pretty easy to explain. The transplant center is in charge of getting their patient, the patient that's at the top of the list, to the transplant hospital. And then the transplant surgeons actually fly or drive to the donor hospital, and they actually are part of the team that does the recovery, and then that organ flies or drives with them back to the transplant hospital. Now, in the case of kidneys that we have to fly across the country sometimes, those can be carried by a special courier service, and we occasionally have to do that. Where they're packed in those coolers that you see on TV, one of the few things that TV does right when they do renditions of organ recovery, and are taken by a courier.
What kinds of organs and tissues can be used?
There are actually 8 organs in the body that can be donated: the heart, both lungs, both kidneys, the liver, the pancreas, and the small intestine. Now, there also are tissues, which are very important because while they're not necessarily life-saving, they do give wonderful gifts and do wonderful life-enhancing things for people. The corneas are considered tissues and can give the gift of sight. Heart valves also can be recovered and transplanted. In fact, Arnold Schwarzenegger, who's running for governor, his life was saved by a human heart valve. There also are skin for burn victims, ligaments and tendons. Dave Fiore, a former 49er, had a human ligament transplant, and only because his transplant was human rather than synthetic was he able to play again in football. So organs and tissues, while one's life-saving and one we refer to as life-enhancing, they're both just as important to the people who receive them.
Now, what is the lifespan of these various organs? Can they be preserved?
Well, organs, when someone passes away, after organ recovery occurs, the heart can only live outside the body for 4 to 6 hours. One of the reasons why it's usually transplanted locally, because it needs to get to that transplant center right away. Kidneys, however, can last up to 72 hours. So there's a national program for kidneys where if someone is a perfect match, which is very, very rare, a kidney can go all the way to New York or New Jersey for that person. So every organ has a little different life. Now, tissues are preserved synthetically. For
You mean
instance,
like skin?
like skin is a perfect example, so that burn units can have skin on hand if someone comes in with a desperate need for skin because they've had a horrible burn, so that they can provide it right away. That's why there's a no age limit for tissue donation, because that skin is preserved. I often say, nobody would want my skin, but they do, because it's preserved in a way that makes it very useful for burn victims and can save their lives. You can be 105 and donate tissues. You can donate your organs up to 80 years of age. And you can donate your organs and tissues no matter what diseases. You may have had breast cancer 10 years ago. You may be diabetic. You may have heart problems. You can still donate. And so what I often tell people, they say, oh, they wouldn't want my liver, I drank too much. Or, oh, I had, breast cancer 10 years ago. They don't want anything in my body. Well, let the medical professionals make that decision. Your best bet is to say, I want to be an organ and tissue donor. I want to save and enhance lives. And let the medical professionals make the decision which parts of your body can be donated, because even if you can only donate your liver and your corneas, that's 3 people whose lives are touched. If you can donate all of your organs, you can save up to 9 people. If you can donate tissues, you can enhance the lives of up to 50. I'm telling you, that's a legacy that lives on forever and ever, and those people's
amazing.
families are eternally grateful.
What is the process when a donor becomes available? What happens?
Well,
what are the steps or stages?
Bear with me, because it's going to take just a minute to explain it to you. The most important thing for us, besides preserving organs for transplantation, saving the lives of those people, and right here in Northern and Central California, more than 8,000 people are waiting for transplants to save their lives. 1/3 of them will die waiting because we have a lack of organ donors in the United States. There are myths, misconceptions, fears, things that scare people, and they're frightened of donating. And that's one of the reasons we're so happy to come and be on your program, so that we can dispel some of those myths. And so I want to explain how it's done so that people understand that besides just the people who are transplanted and whose lives are saved, the donor families are our true heroes. Because what happens when someone passes away that's medically suitable for for organ donation? The hospital is required by federal regulation to call us. That's because of the shortage of donors. And then we are required to go on site at that hospital and ask the family if they're interested in donating their loved one's organs. Often people think, oh, we just hang around hospitals like organ vultures waiting, till somebody dies. Not the case. We are called, we are required to go, and we're required to ask. So we have family specialists, people who are trained to take care of families who are in that time, and oftentimes the families tell us that this was the one good thing that happened to them, is that they were able to know that their loved one lived on. Mothers of children often say to us, I could save another mother. I could save 5 other mothers from having to go through what I went through. But we take good care of those families. Once that consent is given, we maintain the donor, do a little work to make sure that all the organs and tissues that are available for donation can be donated. We go into an operating room, we do a very simple and respectful organ recovery, and that person is then taken to the morgue and goes through the regular process of funeral, and they're not disfigured in any way. They can have an open casket funeral, and those organs are then taken to the people who are going to be transplanted, and those lives are saved.
What about black market organs, black market surgery?
There's another one we hear all the time.
Because, there was the scandals about the black market adoptions, people buying adoptions. Could people buy organs on the side? Well, I know from everything you said that's probably not the case, but I did want to touch on it.
No, and I appreciate the question. Not in the United States of America.
Okay.
You can't do it. The sale of organs is illegal. Now, you can go outside the country. And people have tried here. Somebody tried to sell a kidney on eBay. I've had people call me and say, I want to sell my kidney. In the Philippines and India, it's a common practice for somebody to sell one of their kidneys. Unfortunately, nobody knows anything about that person, and there's no follow-up care for that person, and oftentimes both the recipient and the donor end up dying. But there is a black market in other countries, and it wouldn't be fair if I didn't tell you that. In China, executed prisoners, their organs are routinely donated. So in other countries, yes. Here, absolutely not. And boy, do we stick with the ethics of our system. It's very, very important that organs are allocated to the sickest people, no matter who they are.
I personally am horrified when I hear those stories, and when people say they're going to another country to get an organ, and I know that they're not going to survive the surgery probably because it's not done under sterile conditions, and they don't know what other diseases those people have been exposed to. But it's not done in the United States. These people are very desperate when they go for operations like that and even think about it.
I think that some people who might like to be donors worry that perhaps if they're in a life-death situation, and perhaps an old person, is about to die or something, and then maybe there's a young person who needs an organ, we say, well, are they going to fight to save us?
Where have I heard that before?
You hear it all the time. That's
Absolutely.
such a common thing that I don't mind bringing it up.
Absolutely not. And please ask those questions, because I know a lot of people out there have those same ones. Judy and I, when we're out in the public, we hear those questions all the time. And interestingly, what you said about an old person versus a young person, there are also as many in the minority communities that have a mistrust of the medical system, that think, well, they're not going to work as hard to save my life because I'm not as important as this person who may, may be a CEO or whatever, whatever. Well, first of all, when you're on the list, we don't know who you are. So it's not like we can do anything to put anybody higher or lower if they're, regardless of their socioeconomic class.
So Arnold didn't buy his heart. And
Arnold didn't buy his heart valves. Mickey Mantle didn't buy his liver. Neither did Larry Hagman. I can go on and on about that. But the most important thing is that doctors and nurses are there to save your lives. They don't even look to see if you're a donor.
If I can interrupt,
Yeah,
I'm an RN.
please.
And I've worked emergency rooms in my life, and I've worked intensive care units, and I've even ridden ambulances. And I can guarantee you that emergency medical technicians and paramedics and nurses and doctors in emergency rooms do not care who that is that comes through the doors. They work to save lives, and after the emergency is over, they might check to see a driver's license to see if there's they're not going to find out if there's a pink dot on it. They're not going to be talking to family members to find out if they're organ donors or not. They're working to save the life of the patient that comes through the door. So that question doesn't come up until long after death is pronounced.
Well said.
That's really nice to
Yeah,
hear.
and I do say that at health fairs and places that I volunteer all the time, because people are always saying that, and it's a terrible misconception. Well, having been a nurse, I've been on kind of both sides of this, because I'm also a recipient of a liver, and I've been near death. Didn't ever think I would be in that position. But when it happened to me, all of a sudden I said, this happened to me. I encountered hepatitis C when I was a nurse, and I was working in intensive care. I didn't even know I was sick. I got it probably 25 or 30 years ago in intensive care. It might have also occurred when I received transfusions. I don't know, because I was never sick at the time. But it did destroy my liver, and it was only in 1996 that I was diagnosed.
What was your feeling when you knew that was your only option?
I was really in shock, and I kind of denied it within myself for a year. I said, well, okay, if you want to put me on the transplant list, but that's not something I'm really going to need, because I've been living all these years with it, and I'm not going to get that sick. The chances are that I'm going to keep going like I'm going. But surprise, surprise, the doctors were right. I got sicker, and it was a big shock. And I remember one day very clearly that I was sitting in the car leaving the doctor's office at Stanford with my husband, and I looked down at a piece of paper that they had written on for me to go get some lab work or a scan or something, and the diagnosis said end-stage liver disease. And I knew what that meant, and I couldn't believe it. I just burst into tears and really broke down, because it hit me all of a sudden.
What was your thought that that you might not make it? I mean, you knew there was a waiting list.
I did.
Was there a lot of panic?
There was. I knew that a third of the people on the list, probably maybe more with liver, I think more than half of the people on waiting list for a liver don't get one. And having been a hospice nurse for so long, I really felt that maybe I should just be content with what God gave me when I was born and not go through with the transplant. Over the next 2 years, I was on the waiting list for 2 years. I did get sicker and sicker, and I made peace with the fact that if in fact I did die, that was okay. And I was ready for that. I really didn't think that I was going to get a liver, and it was an immense, overwhelming blessing that I was one of the lucky ones that got one. I couldn't believe that.
It's a very personal question, but how does it feel to know that you have someone's organ, and do you think about it every day? Do you thank them, or do you sometimes just forget about it because life is so good? You've gone on, and
I never forget it.
You don't?
No, I don't. I can't forget it. It's a totally life-changing experience. I do feel like I'm pretty much back to a normal life. It's been 5 years and 4 months now. But having been through a near-dying experience and been so close to death, you just never forget that. And I have written letters anonymously through the donor network to my donor family. I don't know who they are. They've never answered any of my letters. And how can you say thank you for your life? That was tremendously hard to write the first letter and the second and the third. The only thing I know about my donor, and I'm one of the few, by the way, my liver came from Arizona, not from California. My donor was 33 years old, and it was a man, so that's all I know.
If somebody watching this program wants to become a donor, what would they do?
The best way for people to make their wishes known that they want to become a donor is by filling out a donor card and by telling their family about their wishes to become a donor. Now, you can get a donor card, or you can find out more information on organ donation by calling us at 888-570-9400. And I'm going to say that again so everybody gets it. 1-888-570-9400, or by visiting our website at www.ctdn.org.
I've seen a few videos which you kindly sent to me, interviewing donor families, and it really was surprising to me to see the peace and joy that they felt having that their loved ones didn't live for nothing. You know, I think especially maybe someone with young children who lost a child, and they would say, "Why? It's not fair." Well, nobody would give up their child to help someone else, but if they've lost them, I guess it is a comfort to think, yeah, some good came of this, I suppose.
And I will say too, in my own story, that I left this part out, but it's pretty amazing that my transplant actually happened on Mother's Day.
Oh my
And
goodness.
I just, you know, I think of the family that in the midst of, obviously it was probably a sudden death, because usually they are, and but I don't know. But in the midst of sudden grief, that they chose to donate, and it was Mother's Day. And there probably is a mother somewhere who did that on Mother's Day, or the day before, or a couple of days before. It's pretty amazing. And
Well, I think, you know, probably in the near future, scientists will be able to reproduce everything our body needs, and eventually maybe just repair what we already have.
absolutely.
But for those today who are living as a result of the gift of life,
It's amazing.
it's a
isn't it?
miracle
Awesome.
right now.
It is a miracle, and that's the way I look at it.
No,
So when you ask me if it's strange to have someone else's organ in my body, it was a terrific recovery process, and it took a long time. But I didn't have any strange feelings about it. I was just so awed by the entire miracle.
so many people say how honored they are, and how, and I've heard so many recipients say this, that they have a new challenge in their life, and that's to live their life to the fullest, not just for them, but for that other person.
That's right.
Because you've got somebody else in there with you, and boy, you're doing it together.
As well as to reach out for all the people that I know in the transplant community, all the friends that I've made that are still waiting, people that are just now being diagnosed that probably won't get an organ because there aren't enough of them. That's why I do all the volunteer work that I do, so that other people will get organs and will have a chance at life. And even children, that we have children on our hospice program, children who could get organs, who could get tissues, who could see again, as well as adults. And if I can help get more organs for them, as I've been blessed, that's what I want to do.
Well, thank you both for being with us.
Thank you so much
Thank
for
you.
having us.
Thank you, Marilyn.
When we got to the airport, it was about 11:15 at night, and Modesto Airport is very dark and deserted, but there were 2 planes in the field. And one of the pilots came over to chat, and when we told him why we were there, he said, "You know, you're making an awful lot of people happy tonight." Well, that's something we knew. We had thought about that. When we were just pacing the halls in our hospital, standing by Chrissy's bedside, just dreading the thought of being without her. We knew there were people in hospitals, other places, who were pacing their halls in anticipation. When they knew that an organ was available, that had been recovered, was on the way. I mean, it just gives me chills now to think about it, because if I had been in their place, I would have been praying so hard. I knew They were not praying for the death of my child specifically, but they were praying for the life of their loved one because, oh gosh, I know, I wish I had been in their place.
Thank you for being with us. If you would like to join our crew or if you have ideas for future programs, you can contact us at the Cupertino Senior Center. The telephone number is 777-3150, or you can reach us at our website, which is www.thebetterpart.com. See you next time.